One thing that kind of jumps out at this point is that you look at a IT band, right? People always talk about, oh, I'm going to stretch my IT band. I'm going to stretch my IT band. And the IT band is a very thick fibrous structure that goes all the way from your hip all the way down to the tibia, and the lateral aspect of the tibia. And it doesn't stretch. Now it is attached to the TFL muscle, the glutes, that kind of stuff. So, but the structure does not stretch.
Welcome to episode 40 of Eat Your Greens with Dr. Black, the podcast where I help you thrive through nutrition and lifestyle. I'm Dr. Black. I'm a board-certified pediatrician and a lifestyle medicine doctor, and I'm ecstatic that you're here today. This is the first episode of season 2. It's the second year that I'm on this podcast journey, and I'm taking a step forward with the podcast. So if you're a regular listener, you might notice some changes to the format of some of the shows this year. I want you to know that I am absolutely dedicated to making this podcast your go-to resource for actionable insights and expert advice to help you transform your health. Now, how am I going to do that today? Well, it is the beginning of a new year, and if you're like me, you're thinking about ways to take your fitness to the next level. Many of you might be adding get more exercise to your list of New Year's resolutions. So I thought it would be a good time to talk about exercise and how absolutely crucial it is for your health. So if you're on the fence about whether or not to pay for that gym membership or dust off those running shoes, if your idea of exercise is running errands and jumping to conclusions, this is the episode for you. I'm going to talk about why you should put it at the very top of your list of New Year's resolutions. So are you ready? Let's jump in. Now, I am pumped to introduce you to my guest, Dr. Tom Lawlor. It would not be a stretch to say that he is one of the best, if not the best, physical therapist in Central Texas. Dr. Lawlor is a licensed doctor of physical therapy, and he's board certified in orthopedic physical therapy. He spent many years on the faculty of Texas State University, where he taught anatomy and worked with many of their athletes, including their water ski team. He currently practices at Texas Physical Therapy Specialists here in San Marcos, where he has literally raised the bar with regard to the high level of quality care offered to patients. A few other fun facts about Dr. Lawlor: he's an Air Force veteran. He enjoys water skiing year-round. He does weightlifting and mountain biking. Dr. Lawlor and I talked about how to get started if you're new to exercise, and also how to prevent injury with something called progressive overload. We discussed the importance of core strength, and he even shared some advice on what you can do at home if you do have a minor injury. Throughout the episode, I'm going to break away from my conversation with Dr. Lawlor to discuss some of the other benefits of exercise. So thank you very much for joining me, Dr. Lawlor. It's really an honor to have you on the show.
Well, thank you. It's really nice to be here. I feel honored to be invited to come on the show. So, yeah.
What motivated you? What inspired you to get into physical therapy?
Yeah, that's a good question. So I was in the military for 21 years, like you'd mentioned earlier, and had a pretty active life, and found that I really liked fitness. I really liked people. And then as I got into studying more, getting prerequisites, I really figured out that I really like anatomy, physiology, that kind of good stuff. And so this profession kind of puts all that together. And so it just was a kind of an organic transition from the military into this for me.
Did you have any previous experience with exercise physiology or in the exercise world?
So I'd always been kind of active, and I'd work out and, tried to stay pretty fit throughout my life. But in the military, I was actually in aircraft maintenance. And what you find out that is that in the medical world, they call it differential diagnosis. In the aircraft maintenance world, they call it troubleshooting. And it's not that different. I mean, you just kind of have to know the systems to be able to troubleshoot the systems, and you can help come to a solution to either fix the aircraft or help the person get back to doing their everyday acts of living.
So you went from airplane anatomy to human anatomy, and they're not that different.
Well, we are biomechanical beings, and that is a mechanical machine. So yes, there's definitely some similarities.
Tell me a little bit about your teaching experience at Texas State.
Yeah, so that was a great experience. I worked in the gross anatomy lab primarily. Sometimes I taught some of the lectures as well, but primarily in the lab. So I got to spend a lot of time, studying the structures, dissecting the structures, and then helping students learn those structures also. And it's powerful when you get to actually see human structures in person. It's really neat.
Let me just jump in here and give you a few shocking statistics. Did you know that only 1/3 of adults get the bare minimum amount of recommended exercise per week? When it comes to teens, it turns out that 81% are insufficiently active. Now, what do we mean by the bare minimum amount of exercise? So it's recommended that adults get 150 minutes of moderate intensity physical activity per week. If you break it down, that's 30 minutes if you're exercising 5 days a week, and only 20 minutes if you're exercising every day of the week. So 20 to 30 minutes of moderate intensity physical activity. That's the bare minimum. Only 1/3 of adults get it, and less than 20% of teens get it. In fact, what we know is that if people would just move their bodies 25% more than they currently do, we could prevent 1.5 million deaths every year. It turns out that sitting is literally killing us. Sitting time, the amount of time you spend sitting on your butt every day, is associated with increased risk of mortality, of death, in an almost dose-dependent manner. That means the more you do it, the higher your risk of mortality. If you can just stand for 2 hours out of the day, doesn't have to be all at once, but if you can just be on your feet for 2 out of 24 hours, you can actually reduce your risk of all-cause mortality. Remember, that's your risk of dying prematurely of any cause, by up to 10%. And the more you stand, the better the benefit. Another study found that low cardiorespiratory fitness, having a low level of heart and lung fitness from lack of exercise, was actually the number one cause of preventable death. And it beat out even things like smoking, high blood pressure, high cholesterol, diabetes, and obesity in that study. So if I've motivated you to get started, let's jump back into my conversation and hear what Dr. Lawlor has to say about how to get started safely. One of my big questions that I get is people who want to know how to change habits. They hear me talking about especially nutrition, but all of the healthy lifestyle habits that will help us, stay healthy as long as possible, reduce our risks for chronic disease, and exercise is no exception. So I've gotten questions. How do I get started without getting injured?
That's a great question. The person has to figure out where they are currently, right? Not where they were when they were 20, not where they were when they're even 30 or 40, but where they are currently. And so doing a little bit of a self-assessment to say, okay, what kind of things can I do? And I feel like I can do this and I won't get hurt. I think the easiest way to start is start with the things that you do every day in life, right? We walk every day. Walking is a powerful exercise tool that use so many muscles and can really just help to increase your health of your legs, of your core, even your arms get used, right? Even neck muscles if you're walking with good posture, right? It's a powerful tool. We sit and stand every day, right? Sit to stands. that's a powerful tool to start to use your body in a very functional manner, right? We stand up, sit down. Well, if we start doing that 20 times in one set, then that starts to challenge our body a little bit, because it's all about progressive overload, right? You just gotta kind of meet yourself where you are, and then give yourself a little bit of stimulus and let your body super compensate, and then give it the rest and the nutrients, including your greens, right?
Exactly.
and then your body will recover and get better, and then you can do it a little bit more next time.
A sit to stand is literally you sit on the edge of a chair and then you just stand up, sit down as fast as you can, or just do it up and as at whatever pace is comfortable.
That's the beauty of it. Basically, it's a squat, right? We talk about squats. To me, squats is a foundational and phenomenal exercise for people to do because of the mobility that it takes and the strength that it takes. And so, yes, it can be all the things that you just mentioned. It could be sitting down slowly. It could be sitting down and then standing up fast. But typically when you're starting, just do it. Just sit down, stand up, sit down, stand up, and try to do it 10, 20 times in a row and see if you can tolerate that. And if you can, great. Do it again about midday. Do it again after you get off of work, whatever it takes. I mean, just to start to add those kind of things in there. So if you take walking, you can do some sit to stands or body weight squats or jump squats, depending on what level you're at. You can start to even do some balance training, because we all need a little balance. If you're a high-end athlete or you're the senior adult that's trying to get into it, you need some balance, right? So start doing some balance activities. It can be easy as putting one foot in front of the other, standing in a corner so you have either wall to lean on if you start to fall over, and try to stay there for 30 seconds, upright posture. I mean, and then switch your feet after 30 seconds. Do that about 3 times. That just kind of gets you going in the right direction. It works a lot of different muscles for the core, for the legs, for everything. If you stand there and hold yourself in that isometric position, it's that easy. The other really fundamental task that we take for granted, especially as we get older, is getting off the floor. Like when I have patients come in and they say, I'm having difficulty getting off the floor, I'm like, great. You know what we're going to work on? Getting off the floor, because getting off the floor is a powerful functional tool also to maintain your mobility, balance, and strength.
I came across a recommendation recently that said, if you're watching TV, sit on the floor. Don't sit on the couch, sit in front of it on the floor. And that way, every time you need to get up to get your popcorn or go to the bathroom, you have to get up off the floor. And that's an easy way to incorporate that into your daily life, because we don't do that, especially here in the West. Like, we don't ever sit on the floor once past a certain age. And the mobility that you can keep, and the hip flexibility and the core strength of sitting upright.
I just recently heard that same thing and started looking at the genius behind the littlest of tasks to create big changes. So yeah, I think that's just a great idea for all the reasons that you stated.
Now, as a pediatrician, that's not a problem, because we'll have small children like toddlers. They're afraid to sit on the exam table. So sometimes you have to meet your patient where they are. Or if I have an autistic patient, I have had to get down on the floor to examine them, because they're not going to come to me. They're not going to tolerate sitting on the table and letting me examine them. So pediatricians, I think, do a good job of maintaining our mobility in the office.
The creativity of a pediatrician is just awesome to watch, for sure. I've got 4 kids, I know.
So sometimes I feel like I'm standing on my head, trying to contort myself just to look in their ears. Yeah, it's interesting.
They keep you young though, right?
They keep me young, to be sure. Now, you probably already know that exercise is good for your muscles and your heart, but in case you need even more reasons to maybe take all that laundry off of your treadmill, let me tell you about some of the lesser-known benefits of regular physical activity. To begin with, it's not only a flex for your muscles, it's a flex for your brain. Exercise has a direct effect on your cognitive health. That's how you think and remember. And one of the reasons for this is that it can promote better blood flow to your brain, and it helps stimulate the release of a chemical called brain-derived neurotrophic factor. And this is a compound that helps support our brain health and has been associated with improved mental clarity and emotional resilience, how we bounce back from emotionally charged events. Exercise can enhance something called neuroplasticity. That's the brain's ability to adapt and to actually form new connections between the neurons. And this is essential for learning. One of the main parts of the brain that's involved in memory is the hippocampus. They've scanned the brains of people before and after beginning an exercise program, and they've actually been able to see an increase in the size of that part of the brain, the hippocampus. This is thought to be the reason why many studies show that adults and children who engage in regular physical activity have better working memory and are adept at learning new material. Regular exercise can improve something called executive function. That's things like planning, problem solving, attention control, and organization. So this can be especially important for kids with ADHD. It can help them with their hyperactivity and impulsivity. Students who are physically active, especially aerobic exercises, things like running, cycling, and swimming, have been shown to have higher grades and perform better on standardized tests. In fact, some studies have even shown that PE programs in school have been linked to improved math, reading, and writing skills. Like I said, most of this benefit comes from the aerobic activity, and it's thought to be due to that increased blood flow to the brain. But skill-based exercises, so sports that require strategy and coordination or teamwork, can also enhance cognitive functions like attention and decision-making. Speaking of my patients, I do see a fair number of teenage athletes. And of course, they're always getting injured, partly because they think they're invincible and, they're lazy all summer. They don't do anything. And then August comes around, they're back into school. The coaches don't care. They're just like, go run 10 miles right now. There's no warm up. And so I see a lot, especially in the early part of the school year, I see a lot of adolescents coming in with their knee pain, their back pain, maybe it's their shoulder. What advice would you have for that group of, how to prevent injury at their level as a young athlete?
Yeah, that's sometimes tough because they have a lot of energy and they're ready to go. And you can preach progressive overload to them all day long, but they don't understand that. They're like, I got energy. I can do this. My body will take it until it won't.
For my listeners who don't know what that is, define progressive overload.
Let's put it back to sit-to-stands, right? If I can do 10 sit-to-stands from a 17-inch chair and I can do them, I can do that within 20 seconds, then I just alter the parameters a little bit and I can start to make that a little more tense. I can either do them faster or I can do more of them. So changing the parameters of the exercise starts to increase the intensity and you're putting more load through the body. And that's what it takes. You have to have progressive stimulus. You have to increase the stimulus through the body and then let it adapt. And then you basically come from that baseline level and you super compensate up just a little bit more. Now you're ready to exercise at a little higher level. So that's progressive overloading.
Just working your way up in a stepwise fashion with enough time to rest, accommodate, and then move to the next level.
Yes. And for myself, being well into my mid-50s, it takes me a little bit longer than the 10-year-old that to probably recover in 24 to 48 hours pretty easily, where it takes me 72 hours, maybe even longer. So you just have to take all these factors into account when you're talking about a person getting back into their sport. Like you said, over the vacation time, they're a little more sedentary. They haven't been operating at the same level of intensity they were when they were playing the sport. Well, your body starts to downregulate. We have amazing bodies. They'll adapt both ways. They will go sedentary very fast and you'll lose a lot of muscle mass and you'll lose a lot of your structural integrity. But as we start to give them stimulus, they will start to compensate and you'll get stronger. You'll be able to do more.
Here's another impressive benefit of regular exercise. Did you know that it can actually reduce your risks of getting cancer? When scientists looked at both premenopausal and postmenopausal women, they found that the risks of breast cancer in women who were physically active were reduced by as much as 10 to 20%. And in part, this is thought to be due to exercise's effect on the level of circulating estrogen. That's that hormone that's most predominant in women. And a lower level of circulating estrogen will reduce your breast cancer rate. Regular exercise also improves your immune system and reduces inflammation, which are both also linked to lower risks for breast cancer. Other studies have shown that exercise can reduce women's risk of endometrial cancer by 20%. And in both men and women, physical activity is associated with a 20 to 30% reduced risk of colon cancer. And this is thought to be because it promotes faster GI transit time, the time that things move from your stomach all the way through the intestines and out the other end. So things are not sitting in there so long, exposing you to toxins and carcinogens and promoting inflammation. Studies have also suggested a link between exercise and reduced rates of lung cancer, liver cancer, kidney, and even esophageal cancer.
Probably the educational component of physical therapy is one of the biggest things that we can do for people, right? Really explain what's going on and empower them to start to help us help them. I think that's I've learned as I've practiced more and more, it's not so much what I can do with my hands, but what I can do with educating patients and getting them and guiding them to do the right things. The body's made amazingly. It will heal. You just have to give it the right stimulus. The brain has to be ready to take on and start to move again as well. That's a tough thing for people to kind of conceive, but it's a big factor in getting back to what you like to be doing. So yeah, getting people back to moving is what we do well.
When I was talking about cancer, I mentioned a couple of times the effect of exercise on inflammation. And so another benefit to regular exercise is improved immunity. It helps your immune system work better. This is because it can enhance the activity of certain cells in the immune system, like natural killer cells, T lymphocytes, and macrophage, and it also reduces the levels of some of the inflammatory chemicals, things like C-reactive protein and something called interleukin-6 that is involved in inflammation. In scientific studies, participants who engaged in moderate aerobic exercise, and this was in the form of brisk walking, at least 5 days a week, had, get this, 40 to 50% fewer upper respiratory tract infections, that's colds and flu, compared to people who were mostly sedentary. When these active individuals did catch a cold, they reported not only less severe symptoms, but they actually recovered faster. The duration of their cold was shortened by up to 2 days compared to the individuals who were not active. Here's another interesting fact. As we get older, adults who don't do strength training on a regular basis can lose 4 to 6 pounds of muscle per decade. So every decade that you get older, you could be losing an average of 5 pounds of muscle just from not being active. When it comes to the crucial importance of maintaining overall lean muscle mass, one of the most important areas that you can focus on is your core. So let's hear what Dr. Lawlor has to say about that. When I do have a teen who comes to see me, even with something like knee pain, and that's the most common thing that I feel like I see is knee pain, and I know I'm going to refer them to you. The first thing I tell them is just start working your core, because I guarantee you, Dr. Lawlor and his team, doesn't matter what you go in there for, they're going to make you do core exercises. Why is the core so important, and what can we do to keep it strong?
Well, so let me share with you one of my favorite phrases about core. You can't shoot a cannon from a canoe. Our limbs, our extremities, we have to move them, and you have to have a strong, stable base to be able to move from. So you have to start with the center of the body, the center of the mass. When the center of the mass is strong, it's going to give you a stronger platform to which to move the periphery, the arms, the legs. So that's probably one of the biggest premises of that we want to work that aspect of it. In the field of physical therapy, we call it regional interdependence, right? We're not just a leg. We're not just an arm. We're all put together. So we have to move in accord, right? We have to move coordinated. And to have that coordinated movement, you have to have a strong core. If not, it's like pushing a wet noodle, right? You're not going to go very far.
So it's just all interconnected. And of course, the knee, especially because it's downstream, it's weight bearing. So everything above it affects that as well.
Absolutely.
And having that strong core, that makes a lot of sense. What are your favorite core exercises that people can do at home?
So I think one of the easiest to do is probably some type of a plank exercise, right? That's basically can be from on your elbows and on your toes and making your body as straight as possible and engaging all the right muscles, which that's a whole nother conversation, right? You want a professional that knows what they're doing and getting you to engage the right muscles. And there's many variations of it. You can have your arms straight out. You can have your arms bent. You can be on your side, doing side planks. You can do it from your knees. There's just so many variations, and that becomes a good isometric exercise to start to give your core a little bit more strength and endurance. That's a big component too. The core has to be able to endure a lot of activity. And so you have to train it specifically to the tasks that you're asking it to perform.
What is your opinion about crunches and sit-ups? Because that's the old school, when I was in school, that was the core exercise that everybody did. I don't even think I'd heard of a plank back then.
Yeah, so crunches and sit-ups, I'm not going to say that they're necessarily wrong. It's a movement pattern that's within our body's ability to perform. The muscles within our abdominals, we have the deepest layer, the transverse abdominis, right? It acts almost like our own weight belt, right? It wraps all the way from the back into the front. And then you have your obliques, you have inner obliques and external obliques. And then you have the rectus abdominis muscle. That's the muscle that you see that you can get the six-pack muscles, right? And that's basically when you're drawing your ribs to your hips, that's the muscle that's probably doing the most amount of work. So those are important muscles to work also, but working the transverse abdominis and working the obliques are very important. Transverse abdominis does a great job of helping us support our back whenever we're taking on loads. The obliques help us move in reciprocal motions, and we're reciprocal beings. So training the obliques the way that they're meant to perform is also very powerful. So you just can't focus on one group in the abdominal section. You need to take on the whole group. As a matter of fact, when people say core, I'd like to think of it as a box. When you're really talking about being strong through the midsection, you want the top of the box, your diaphragm. You have the pelvic floor on the bottom of the box, and then you have your erector spinae in the back of the box, and then you have those four groups of abdominal muscles that I talked about. So you want to do exercises that are going to kind of engage those together in unison to create the strongest center of mass that you can.
Excellent advice. I will start doing more planks tomorrow.
Remember, progressive overload.
Progressive overload.
Yes. Meet yourself where you are.
I think maybe I'm weird. I kind of like planks. So don't tell my personal trainer. She'll just make me do more.
Hey, I had a lady who was well into her 70s that could side plank for over a minute.
That's because that's also arm strength. That's what gives out on me, side planking. My shoulder, that's the thing.
Yes, and that's the beauty of a plank also is it can help your shoulders also. It can help your knees. It can help your hips. So it's going to help a lot of different things. That's why I'm a fan of that exercise. And the plank doesn't have to be on the ground. I mean, it can be you're leaning on a table with your arms stretched out and doing an incline plank. So now you decrease the amount of load that you have on your body, and then you can progressively overload by taking the table down lower and lower and lower.
Excellent. All right, you heard it. Eat Your Greens listeners, we have a challenge. We have a plank challenge. I want you to send me your photos and how long that you can hold your plank, and we'll have a prize for the winner.
But please progressively build up.
Yes. All right, it's me again. I'm jumping in again to tell you one more benefit of regular exercise. I'm going to give you one more excuse to get that leash out and take your dog for a walk. If you're regularly lifting weights in the gym, you might also be lifting your mood. Even one single session of physical activity can improve your mood. And this is because exercise will release chemicals called endorphins, which are natural mood enhancers. We also see changes in the levels of neurotransmitters that are involved in mood and emotional regulation, things like dopamine and serotonin. Not only that, but participating in a group or a team activity provides an opportunity for social connection, which is also very strongly associated with lower rates of depression. Exercise reduces your stress level by reducing the level of that stress hormone, cortisol. And remember that study that was done on people who were exercising where they scanned their brain and showed an increase in the size of the gray matter in the hippocampus? Well, another thing that they picked up on, those study subjects who were undergoing the exercise program had an actual decrease in the size of a different part of the brain called the amygdala. The amygdala is heavily involved in detecting threats, in triggering fear responses and, that fight or flight reaction. And so it's very closely associated with symptoms of anxiety. So the people in the study who were exercising had a decrease in the gray matter of that part of the brain. In fact, regular exercise is so effective at improving mood and reducing the symptoms of depression and anxiety that in many cases, if symptoms are mild to moderate, it can be used either on its own as a solo therapy or in addition to the standard treatments of counseling and medication. Now, of course, if you're in crisis, if your symptoms are more severe, if you're actually at risk of hurting yourself, then it would be inappropriate to suggest that you just go to the gym and work out. In that case, please definitely seek a professional help. But in more mild or moderate cases of depression and anxiety, exercise is a super effective therapy that can be used either in conjunction with standard counseling and medication or even on its own as a solo first-line therapy. So now that I've convinced you to put on your spandex yoga pants, your leg warmers, and, in the immortal words of Olivia Newton-John, get physical, let's learn what to do if you go overboard and sustain a minor injury. Let's talk a little bit about what to do if you actually do have a minor injury. So you've started having some pain, maybe you rolled your ankle, something like that. What can patients do at home for some of these more common issues to maybe mitigate the need to have to do physical therapy?
Yeah, that's a good question. Roll ankle is a very common injury that occurs quite often. I've had a few of them myself. I think let's use that as an example. If you're a rolled ankle, the first thing you have to determine is, do you think you have a fractured ankle? Basically, if you can't walk at least 4 steps on that and not be in a lot of pain, it's probably a good idea to go get an x-ray. The other thing that does for you is there's a big dichotomy between how you're going to treat a fracture and how you're going to treat a soft tissue injury, right? So what's the old adage for treating soft tissue injuries?
RICE, rest, ice, compression, and elevation.
Right. And that's been around forever and ever and ever. And so they were starting to see that taking a little bit more of an active approach to bringing yourself back or doing some home treatment can work and get you back to play a little faster or get you back to doing whatever you like to do a little faster. And the new one is peace and love. So that's a few more letters to define out, but let me see if I can do my best for you and pin it down for you. So the P stands for protection. You got to protect the joint. So if it's an ankle, put a brace on it for the first 72 hours or so, protected it a little bit and give it the rest that it needs, right? And then you need to elevate it. Elevated, of course, will help decrease some of the swelling. The other thing that's really, really counterintuitive is everybody wants to reach for the ibuprofen or whatever anti-inflammatory or NSAID that they use to help decrease the inflammatory process. The problem with that is, believe it or not, inflammation is good in an acute injury. It actually kicks off the first process of the healing. You want that first cascade of mediators to start to work and start the healing process. So if you can deal with the pain, if you can do other things like the next thing, compression, start to compress it just a little bit, that can help give you some relief. It can also help decrease the swelling, which when the swelling gets out of control, that's when more pain's going to occur, right? That can really help. And then education, just knowing that, okay, I don't need this thing in a boot for a month for it to heal, right? I need to get it moving. And that's really important. If people start to understand that motion can help them heal a little faster, that's a good thing. And then that moves you into loading it. You want to start to properly load it, right? If you can tolerate putting it down on the ground, put it down on the ground. If you can tolerate standing on it, stand on it, 2 legs, then start to stand on it 1 leg, right? So you're progressively loading it. And then the other cool thing about this is a very holistic approach as well, because the O in love stands for optimism. Be optimistic that you can get through this. This is not a huge setback that's going to ruin your career. You can get through this. And that positivity is going to actually aid in the healing. And then you want to start doing exercises that is going to increase the blood flow to it, right? You don't need a lot of load on it to begin with. So you could do like a cycling activity, or you can do an easy range of motion activity, anything just to increase a blood flow, just really meeting the tissues where they are in their stage of a healing. And then eventually you get back to exercising. And then that's really where you have to say, okay, I can't now go out and run a 10K. I have to start with walking a quarter mile and making sure that I respond appropriately to that, and then start to just kind of meet myself where I am and use pain as the guide to get back to doing what you like to do.
That is a big shift from where I was trained, because I was definitely trained in the Rice era of rest, get the crutches, don't put weight on it. And not only stood for ice, but also ibuprofen. And I was trained that for musculoskeletal pain, ibuprofen was better than acetaminophen. So this is a big shift for me to learn this. So I just want to go over it again, make sure I got it. So it's peace and love, and P, protection, E, elevation, A, avoid the anti-inflammatories.
Including ice.
So no I. There's no I in peace and love. You're right. C, compression. That one is still the same. If you have swelling, wrap it, and to help with the swelling and to give it some support.
Yes.
And then E in peace is education. Learn from an expert like yourself what you can do. And then love, load, optimism, vascularization, which was that movement to help bring blood flow and all of those great healing components in our blood to the joint. And then exercise, which is progressively advancing from where you can tolerate and then gradually returning back to your baseline.
Absolutely.
Big shift.
Big shift.
Definitely going to be sending out a message to all of the doctors in our office, although many of them now are younger. Maybe they already know this. Maybe it's just the old ones like me who are going to have to make a bit of a change to how we approach our care.
And here's the deal, too. That's where I wouldn't throw the baby out with the bathwater, because I still feel like here's what I tell people when they come up and they say, I have this injury. What should I do with it? And so I usually give them the caveat. If the pain is not too bad, if the swelling is not too bad, and you can tolerate those things, then here is the best thing that you can do for it. And then I give them the peace and love, right? But sometimes it takes clinical decision making, right? And sometimes you have to, take the lesser of the evils, right? So I'm going to tell you, okay, start with ice. If you can control the pain with ice, let's control the pain with ice, and let's go from there. Because I think that's probably a little better than putting an NSAID into our system, right? So I still don't think you totally throw the baby out with the bathwater. I think that you just realize, okay, motion is good. Motion will help speed the healing if it's applied correctly. And if you have any questions, if there's any doubt in your mind, then that's when you need to seek an expert's opinion. The good news is, a little plug for physical therapy in Texas, is you don't have to have a referral from a physician to come to see a physical therapist anymore in Texas. You can come and see us. It's a short amount of time, but it's enough time for us to assess you and kind of determine if you do need to go see either an orthopedic surgeon or another provider that's their specialty and can help you. It's out of our scope of practice. We're really good determining when things are out of our scope of practice. And so that's what I'd recommend you do. If there's any doubt, go see either a physical therapist or your primary care provider, and get the appropriate care for yourself.
And I'm learning more and more reasons not to recommend NSAIDs. That's non-steroidal anti-inflammatories, and that's things like ibuprofen, naproxen. Not only from you in this context, which was a new piece of information for me. I mean, we know that it can cause upset stomach, and if you overuse them, even bleeding of the gastric lining, right? But it also has a direct negative effect on the microbiome. And all of my listeners just started laughing because this is an episode about exercise, but I will find a way on every single one of my episodes to talk about the microbiome somehow. And this is it. NSAIDs and ibuprofen actually are detrimental to our gut microbiome. And so more and more I'm learning, like, this is not really a great drug. I'm sure it has its times when it's useful and it has its place, but by and large, I have stopped recommending it as often as I may have in the past. And this is one more sort of nail in that coffin for me, that it's going to be much less often that I recommend ibuprofen and similar drugs, I think.
Well, you just taught me something, because I am a fan of the microbiome. And just because I've recently started looking into the microbiome in the mouth, that helps kick the process of nitric oxide being produced within the body. And the nitric oxide is amazing because it helps to vasodilate vessels, which gets blood to working muscles and working tissues and helps the healing come a lot faster, helps regulate our blood pressure, does a host of amazing things. And I recently found out that kind of along the same way is mouthwashes actually will kill off the microbiome in your mouth as well. And so I've never used mouthwash a whole lot anyhow, but definitely staying away from it at this point, and definitely trying to eat as much green leafy vegetables as I can, because they are what provide the nitrates to create that nitric oxide. And so if you don't have those building blocks for your body to create it, then it's not going to happen. So eat your green leafy vegetables.
There you have it. Even the physical therapist wants you to eat your greens. I love it.
Specifically spinach and kale. Those are my jams.
Those are really good, right? I like Swiss chard as well, but kale is my go-to. I've really learned so much from this conversation today, and I know my listeners have as well. I'm certain of it.
It's been a lot of fun to talk about one of my favorite topics. I feel very blessed that I, as a physical therapist in Texas, can't prescribe any medication. And sometimes I really, really enjoy that, because my patients don't come to me looking to get medication. It's what I can do with education, what I can do with movement and exercise. That's what I can do with their bodies to teach them to use their natural processes for healing and educate them in how they can get better. And so that's kind of a blessing in our profession, is that we can. But I would say just, you got to start, kind of meet yourself where you are. And that's basically do a good self-analysis of, hey, what can I do that I know I can do, and kind of go from there. And if there's any question in your mind about that, go see a physical therapist.
Excellent advice. So just to summarize, we talked about how to get started, no matter where you are, whether you're a younger athlete or somebody like me, an older person who's never been an athlete, and how to get started. You start where you are and gradually build on it, that progressive overload. And we talked about the importance of maintaining your core, some things you can do for some of the specific joints in your body, not only to keep them mobile, but also if you do have a minor injury, some of the things you can do at home. And then when to recognize if you need more help, when to go see your primary care doctor, or thankfully now you can just call your physical therapist and schedule an appointment. Of course, insurance allowing, the big overlord of healthcare, right? All amazing points. And I really appreciate you helping my patients and my listeners learn how they can really protect their health, start where they are, and extend their lifespan, because exercise is medicine and it is so crucial for our health.
Well, it's been an honor to be here. Keep moving.
Thank you very much. So what did you think? Did you learn as much as I did? I'll tell you, I had never heard of Peace and Love before. I have been recommending rice to all of my patients. So I am really thankful to have had the opportunity to have that conversation with Dr. Lawlor. And I will be making some changes to how I take care of my patients as a direct result. Now, if you're just getting started on your exercise journey, don't sweat the small stuff. Just get out there and do your best. Remember that progressive overload piece, right? Start where you are and gradually work up. The official recommendation is to aim for that 150 minutes of moderate physical activity per week. But if that's not attainable for you, don't just throw in the towel. What we know is that any amount of exercise, even 5 to 10 minutes of moving your body, will have a significant impact on your health. In fact, what we know is that most of the benefit from exercise starts when people go from completely sedentary, no physical activity, to just getting started. The rates of mortality, chronic illness have the steepest drop in that first beginning part. So don't worry if you can't achieve the minimum recommended amount. Just get started. Anything you do, you will reap the benefits. I want to thank you for listening to the Swole episode. I hope you didn't have to muscle through it. I did try to come up with a few jokes about burpees, but I just couldn't get them off the ground. So if you're like me, you're listening to this podcast episode while you're taking your dog for a walk, do me a favor, scroll down on your app and hit that subscribe button, follow the show. You can go to the website, eatgreenswithddrblack.com, and subscribe. Not only will you get an email every time I release a new episode, but I will jump for joy. Thanks for listening, and don't forget to eat your greens. Please be aware that this podcast provides general health information about nutrition and feeding of infants and children and is meant for educational purposes only. It's not intended to replace the important relationship between a parent, child, and pediatrician. If you have concerns about your child's nutrition, health, or growth, please consult your doctor.